multiple organ dysfunction syndrome (MODS) is a severe form of SIRS where there is damage to two or more organs. So that the temperature that is less than 36 degrees Celsius or above 38 degrees Celsius, and upon the heart rate is greater than 90 beats per minute, that is tachycardia. If the respiratory rate is greater than 20 beats per minute, or PaCO2 that is less than 32 mmHg, or white blood cell count is that is 4 lakh μ or less than or greater than 12,000 or greater than 10% bands, that leads to systemic inflammatory response syndromes. So first response, how to stabilize the patients. We have to admit and monitor. So we have to admit the patients to the ICU, and we have to monitor the vitals for several times, and we have to oxygenate to the patients. So we have to administrate the supplement oxygen by face mask, or if it is not okay, then we have to move to the intubations, that we have to secure the airway. So the intubations and mechanical ventilations if needed. Shock is severe or if ventilation is inadequate, we have to secure the airway we have by doing the intubations, and we have to restore the volume. So begin intravenous fluids initially, that is 1 liter of 0.9% saline is infused over 15 minutes. Further fluid therapy is based on the underlying conditions and may require continuous monitoring of CVP also. So, targeting the cause for cardiogenic shock, if BP remains low after a fluid challenge, an intravenous infusion or noradrenaline or dopamine is started. Dopamine is preferred and inotropic, where coronary interventions like percutaneous coronary interventions may be required. For septic shock, parenteral antibiotics, that is piperacillin, tazobactam, are started. If there is if there is an suspicions of septic shock. For adrenal insufficiency, intravenous steroids can be given for the adrenal insufficiency. So how we manage it? So based on that management, we have given an algorithm. So if the four shocks has appeared, that will trigger the organs. So we have to recognize through the clinical signs, or by the criteria we have seen now. So if it is more than two, means it leads to SIRS. So and then investigation, by doing the investigation, LFT, RFT, ABG, and echocardiography, ECG, whatever. And we have to stabilize the patients by using the face mask, or if it is not okay, we have to do by intubating the patients, and we have to fluid resuscitations also it is targeting. And we have to target whether it is leads to the cardiogenic shock. If it is due to the cardiogenic shock, we have to give the vasopressors. Otherwise, due to the septic shock, we have to administer the antibiotics. Or whether it is adrenal insufficiency, we have to give the steroids. Or if it is an obstructive address, we have to address the obstructions, whether it is a neurological or anaphylactic, whatever we have to see. So systemic approach from recognize the initial trigger to applying the target therapy is critical to halting the cascade and managing the patient in the shock also. And so coming up to the summary, will be I think you have understand the medical shock as a clinical guidance, that hypovolemic shock has a less fluid, whereas the cardiogenic shocks occurs in the cardiac, so that the cardiac tamponade will be occurs. Then obstructive shock we have seen through the examples also, and distributive shocks also we have seen. And according to the pathophysiology, we have shown about the like a cascade. So inadequate perfusions of tissues, so that the hypoxia will be occurred, and it will be shift to the anaerobic metabolisms, and due to that person there is cell dysfunctions and toxic release also. And through that thing, the systemic inflammations occur, so that the damage of an organs will be also occurring. So if the damage of organs is more than two, it's called as SIRS, that is systemic inflammatory response syndromes, whereas and that leads to the multi-organ dysfunction syndrome, that is MODS, and even it leads to the death also. So I hope all has understand through this PPT what we have created through our SNS. So thank you, and we have referred the Manipal Manual of Medicine, that is third, and we have given to YouTube resource link also, so that you can also watch through it. Thank you.